morning, everyone. I am Heather Fry with your Claremont County Chamber of Commerce, and today is October 23rd, and everyone pretty much is aware the month of October is Breast Cancer Awareness Month. And we are super excited this morning because we have one of our sustaining sponsors, Mercy Health Physicians, on the line with us today. And we're going to be discussing breast health, breast cancer, and our call to action at the end of the interview. But I want to welcome, good morning, everyone. And like I said, I'm going to be very good at these names. I've been practicing them. I'm doing very well. We want to welcome Dr. Abigail Tremelling, Dr. Nicole Melchior, and Dr. Joseph Benjamin. Good morning, everyone.
Good morning.
Good morning. Good morning.
And isn't this wonderful? We could all be in the comfort of our home or our office. COVID, we're all safe, and we all could do this interview and make sure we educate our listeners, our chamber members in the community, on breast cancer awareness. So tell us a little bit about yourself. We're going to start with Miss Abigail.
Great, thank you. So I grew up in Cincinnati, have been away for several years for all of my medical training, and just recently moved back to serve the community I grew up in.
All right. All right, Nicole?
So I am originally from upstate New York. I grew up in Syracuse. I did all of my medical training and fellowship in Philadelphia. And then about a year ago, we moved to Ohio. My husband's in the military, which is what brought us here. So we've been enjoying our time.
Thank him for his service for us, please.
Thank you.
And Dr. Benjamin, tell us a little bit about yourself.
All right. So I'm a radiologist with specialized training in breast imaging. Like Nicole, I also grew up in upstate New York. But we moved back here because my wife grew up just up the road in Dayton. So we're very happy to be here.
Well, thank you all three for taking time out of your day to help educate us on breast cancer awareness. We're going to talk about symptoms of breast cancer. I think everyone can raise their hand if they've been affected, someone in their family with cancer or breast cancer. The day that we could cure cancer is the day that the world will be celebrating. But October is Breast Cancer Awareness Month. And Dr. Tremelling, we would like to ask you a few questions so you can help educate us. What exactly is breast cancer? We hear it all the time, but what is breast cancer?
Right. So cancer in general is anything where cells in the body grow abnormally and out of control. And breast cancer specifically is when the cancer cells develop in the breast. Most commonly, they come from the milk ducts, but they can have other places of origin within the breast. But most commonly, they're from within the milk ducts. It's important it's important for all women to know about this important topic because it's the most common cancer that does develop in women in America, right behind skin cancer. And in fact, 1 in 8 women, or about 12.5%, will be diagnosed with breast cancer in their lifetime in the United States.
And that's a high number.
Yes.
Yes, it is. And you talked about women. So who actually gets breast cancer?
So, of course, women, and that's always our focus, but men can get it as well. It's just much less common. Really, anyone who has breast tissue can develop it. There are some risk factors that make a woman more at risk to develop breast cancer, and those can include primarily just being female and getting older. Those are the 2 most common risk factors. But other things to talk to your doctor about is if you have a family history of breast cancer, a family history of ovarian cancer, because those can be related, a genetic mutation that has been known to cause breast cancer, a history of atypical cells on a prior biopsy after an abnormal mammogram. Women who have dense breast tissue are actually at slightly increased risk as well. Regular or excessive alcohol intake actually increases your risk, as well as being overweight, because it has to do with the effects of hormones on your body, and that's related to fat tissue in our bodies. Things that decrease your risk are having more regular exercise, healthy diet, Things that also increase your risk can be when you had children. So if you were at an older age when you had your first child, or if you did not have any children, that does put you at slightly higher risk, as well as hormone replacement therapy at the time of menopause can increase your risk depending on the length of use. And if you had radiation to the chest wall as a young child. So lots of risk factors, but basically as long as you talk to your doctor and have a thorough discussion with them, you can help get some insight into your risk. If you have any of these risk factors, it doesn't mean you will get breast cancer. It just means that you should talk to your doctor about it and make sure, of course, that you stay on top of screening mammograms, because that helps us catch a cancer early when it's most easily treated and the treatment's most effective.
Okay, so let's talk about your alcohol intake. Now, how many is too much? And it is Friday, so how many are we talking about?
A couple of drinks is okay. It's really if you have regular alcohol use daily, multiple drinks a day. The more alcohol you drink, the higher the risk. So a couple of drinks at happy hour or on the weekend is okay. It's get into the regular use.
Thank you. And then also, maybe we're not aware of the symptoms of breast cancer. So no, you were giving us who's at risk, but what are some of the symptoms of breast cancer that you probably should call your doctor immediately?
Right. So everyone thinks about, of course, feeling a lump in their breast, and that's the most common symptom that someone might notice. Other signs would be changes to the skin of the breast or the skin of the nipples. If you notice any puckering of the skin, dimpling or retraction of the nipple, any changes to the color of the breast, like redness, sometimes discharge from the nipple. Sometimes that can be totally normal, but sometimes we need to investigate further. And then even a lump under the armpit can be a sign of breast cancer. But the most important thing is that many women have no symptoms at all. And that's why mammograms are so important, and what Dr. Benjamin will talk about here soon. That allows us, again, to detect it before you feel anything in your breast.
Thank you for all those answers and helping to educate our listeners. And great segue for Dr. Benjamin. Now it's your turn. So I know everyone, the Mercy Health offices are right around the corner of the Clermont Chamber. And I believe, Dr. Benjamin, you're in the offices right now. And our question to you would be, who should get a breast cancer screening and what all is involved with that screening?
Of course. So a mammogram is a low-dose X-ray that we use to check the breast for breast cancer and other abnormalities. As Dr. Tremelling mentioned, a mammogram can detect breast cancer early, even when it's small, and even before a lump can be felt. So that's when it's easiest to treat. A screening mammogram is used to look for signs of breast cancer in women who don't have any of those breast symptoms that were mentioned or any problems at all. In those asymptomatic women, we take X-ray pictures of each breast, typically from 2 different angles. So that's a screening mammogram. The overall process takes less than 10 minutes. As far as who should get a mammogram, what we recommend at Mercy Health, and that's supported by our national societies, the American College of Radiology, Society of Breast Imaging, as well as the American Society of Breast Surgeons, is a mammogram every year beginning at age 40.
So there are several places around the east side that you could schedule your mammogram with Mercy Health. Can you give us some of the locations? And I know our listeners are everywhere right now, but you've got Clermont County covered in the east side. So where do I schedule my mammogram with Mercy Health?
Absolutely. So very convenient sites over here on the east side. We have Claremont Hospital. We have Anderson Hospital. We have the new Eastgate Medical Center on Ivy Gateway, as well as Milford Imaging over on Old Bank Road.
Wow. So you have that covered. COVID right now, we're seeing an uptick of cases. Is COVID affecting the number of individuals that are having their mammograms done this year? And how safe is it, the environment, to schedule and not be worried about the COVID?
COVID is absolutely affecting us. We currently have thousands of women who typically come to our Claremont County locations who are in fact past due for their mammograms. We've seen about a 20% decrease leading up to this month in the number of screening mammograms that we're performing. And remember, those screening mammograms are an essential tool for us detecting women who aren't having any problems. We don't see the mammograms, we can't find the cancers.
So that's really important that people are aware when they schedule their mammogram, you have all the steps in place to keep them safe, wearing the masks, you have sanitizing stations, and you can take care of their screening. Like you said, it takes 10 minutes, you're in and out. And
Absolutely.
Don't let COVID deter you from scheduling this. It's very important.
That's a great point. We want all current and future patients to, in fact, know we're doing everything we can to keep them safe while they're here in our care. That's, as you mentioned, mandatory masking, social distancing, and enhanced equipment cleaning between patients. What we've been saying, Heather, is that breast cancer, unfortunately, doesn't stop even for a global pandemic.
Absolutely. So I've been hearing about this program, and I don't know anything about it. It's called the I Know program Mercy Health is offering. What is that benefit? Can you tell us a little bit more about that?
Sure. That's something that we're offering at Mercy Health in order to expedite the results notification process after you have a mammogram. So that's something that we offer at our state-of-the-art Eastgate Breast Center. That program gives patients the option to stay on site after their screening mammogram, to have any additional imaging performed if they need, or to just get their results. That reduces the number of return visits, and it also decreases that worrisome waiting period in between the time of the imaging to the time that the patient receives the results.
So I actually have experience. I received my mammogram. It's not been quite 12 months. They scheduled me early in the morning before work, and I believe I had my results by the afternoon. And they kept saying, if we see something, you can come right back, go downstairs, and get the next scheduling of tests immediately. So that was very reassuring to me that if they found something, I didn't have to wait and schedule downtown Cincinnati next week or wait 2 weeks to get in. I could go back to Ivy Point. They would take me right downstairs and have everything, all the tests ready.
Yeah, we absolutely know that waiting can be one of the hardest parts.
It is. No one likes it. We're impatient people. We want it now. We know that. So the Mercy Health locations on the east side of Cincinnati and here in Claremont County, they just started the high-risk breast cancer program. Tell me what this means to anyone that has breast cancer screening at Mercy Health's east locations.
So that's one thing that we're doing to increase our patients' knowledge of their own risk of developing breast cancer. When patients come to our facilities for their screening mammograms, they're given an individualized risk score based on their own personal and family history. If that score is elevated, they'll be given the option to meet with one of our fellowship-trained breast surgeons who are also on this interview for a more formal risk assessment to ensure that we have a personalized plan in place so that we can closely monitor those patients at high risk.
That's important to know. Everyone is worried. Everyone has cancer. There is someone in their family or a friend or a close relative that has either dealt with cancer themselves or a family member. So it's really important to know that Mercy has all the necessary as far as support, answers, education, screening, tests, everything. One-stop shop. Am I correct?
That's absolutely right.
You got it. Well, thank you, Dr. Benjamin. And now we have a few questions for Dr. Nicole Melchior. Did I say that right? Look, I got to unmute you first, don't I? Got to make sure you can talk there. I'm so glad I said your last name correctly. So if cancer,
you did. Thank you.
Good. If cancer is detected, how do you work with your patients to determine the best treatment options and plan? Because that's devastating news. And I know there's different levels of cancer, but someone on the other end that receives that phone call or that message, what happens from there?
Sure. So at Mercy, we work with a really great nurse navigator who is typically the one who makes first interaction with the patient. She meets the time of their breast biopsy, and then if it does come back to show a cancer, she notifies them as soon as possible, and she connects them to a breast surgeon at Eastgate. That would be either Dr. Tremelling or myself. So then we would meet with the patients. We actually have 1-hour appointments for all of our new cancer patients. At those appointments, we review their pathology report with them. We go over their images with them to make sure that they have a complete understanding of, exactly their diagnosis. After that, we'll review all of their treatment options. And for most women, this will ultimately require surgery. So thankfully, most cancers are small, and we can treat these with a lumpectomy, which is where we just remove the area of cancer and we can actually preserve the rest of the woman's breast, which is really a great thing. Unfortunately, in some cases, if the cancer is large or if there's multiple areas of cancer, there are times when we will need to do a mastectomy, which is where we completely remove the breast. If we do have to do a mastectomy, there are options for breast reconstruction, and commonly we can actually do these cases together with our plastic surgeons to perform both the cancer operation and the breast reconstruction all at the same time.
That's really good to hear.
It's a really good thing for our patients. And thankfully, most of the patients we see will have the option to have a lumpectomy or a mastectomy. So at their appointment, we will review the details of both procedures, the pros and cons for their specific situation, and help to, have them make the right decision about what type of surgery is best for them. And we do briefly talk with them about treatments that will be needed after surgery as well. Commonly, patients will need additional treatments, which could be either radiation or medications. Most patients that have lumpectomy will be recommended to get radiation treatments after, and that's to help decrease the chance of cancer coming back in their breast. Sometimes we even do have to give radiation to women who have had mastectomy. And then in terms of medications, there are certain types of breast cancers that will require treatment with medicines. The main medications we use would be either chemotherapy in some cases, which is given through an IV or a port. And then another type of medication that we'll use is called endocrine therapy. It's essentially a hormone blocking pill that a woman may need to take once a day. That also helps to decrease the chance of cancer coming back. So there are a lot of components that go into the treatment of breast cancer, but we try to realize that every cancer is different, every patient is different, and we need to make a customized plan for each patient.
Yeah, and that's important because what one lady who's diagnosed is not the same as the next lady. And
Exactly.
the treatment is completely different.
Exactly.
So and who all is part of the breast cancer patients healthcare team at Mercy Health? So everyone is seeing 3 of you, and you're part of the team. But who else is part of the breast cancer patients healthcare team?
So typically at Mercy, the first appointment the patients will have would be to see one of the breast surgeons, myself or Dr. Tremelling. And then we do have a larger breast team that we work with to provide individualized treatment plans for each patient. So we have a biweekly tumor board meeting. And at these meetings, we discuss all of our new cancer cases. Typically at the meetings, we will have a radiologist like Dr. Benjamin, who will review all of the imaging. We have a pathologist there to review all of the biopsy results under a microscope to confirm the diagnosis. Breast surgeons like myself and Dr. Tremelling are there, radiation oncologists and medical oncologists. So we're all kind of reviewing the cases together. We typically will also involve genetic counselors, and they do tests to help look for gene mutations that could potentially run in the family if that's indicated or if the patient's interested in that. And then we also have physical therapy available that can help with any mobility issues or swelling post-operatively. And we're very lucky at Eastgate because we actually have all of those services right in one building. So it's convenient for patients.
So even though we're seeing three of the team members here, there is a whole slew of the team members over there that can help with every aspect.
Exactly. And typically, most commonly, again, everyone is different, but most commonly, they would be meeting with the surgeon first. And then typically following surgery, we would then have them also individually meet with their medical oncologist and radiation oncologist. So we do all work very closely together.
So you guys are the dream team, correct?
We try.
So the call to action right now is people are listening to this and they're like, I haven't scheduled my breast exam because of COVID. All they have to do is call 513-95-MERCY, and that will get you into the operator, I would say, and then you can schedule any of the exams. Just 513-95-MERCY. Is that correct?
Yes.
All right. So now is the fun part. So yes, October, Breast Cancer Awareness Month. Last word going around the pike till we do some fun stuff here. What is your call to action right now, Dr. Tremelling? What would you tell people right now?
Just to make sure that you're up to date on your mammogram and that you speak with your healthcare provider to get a better sense of your risk, and if you need to see one of us to talk about that in more detail.
All right, Dr. Benjamin?
I'll keep it very simple. Mammography saves lives. Our motto is detect cancer, defeat cancer.
That's really good. And Dr. Melchior?
I just agree with both Dr. Tremelling and Dr. Benjamin. I think it's so important to have your mammogram. I know people are worried, rightly so, about COVID, but we really are taking all those precautions both at mammography and also in our surgery office. So if you feel something, if you're concerned, don't delay and just give us a call. We'll be happy to see you.
And don't forget, 513-95-MERCY. You can schedule at any of these locations: Anderson Hospital Women's Center, Claremont Hospital, Eastgate Medical Center, and Milford Imaging. So we've got everything covered. Okay, so now the lightning speed round of fun stuff. Are you ready? All three of you, show of hands, who's the funniest out of all three of you?
Dr. Benjamin.
Dr. Benjamin.
Dr. Benjamin. Okay. Who's the most tired out of all three of you? Dr. Benjamin? No? She's going to the side here.
A couple of us have very young children, so I would vote Dr. Melchior there.
Yeah.
There you go.
Who are you, Dr. Benjamin?
I got that too.
They're blaming you again. All right. For fun, what do you guys like to do in your off time? Not being a parent, what do you like to do for fun? Parenting isn't fun sometimes. It's tiring. What do you like to do for fun?
You said not parenting?
Not parenting.
I have a 2-year-old and a 7-month-old. That's really all I do. We like to spend time outside, go on walks. We haven't been out of the house too much because of COVID, but staying active outside is what we like to do.
Perfect.
My husband and I enjoy exercising outside when we can, when it's nice out, and also little house projects and house renovations. It's pretty handy, and we're always finding something to fix up and upgrade.
Nice. And Dr. Benjamin, what do you like to do for fun?
Well, aside from my 4-year-old and 18-month-old daughters and playing with them, I'd say I like to get a round of golf in when I can.
That's nice. Well, we'd like to thank you for taking the time to educate and to make sure early detection is the best form. So we've got to make sure people get out there and schedule their mammograms. All they have to do is call 513-95-MERCY. That's 513-95-MERCY. You can't mess that up, right? It's pretty easy. Schedule your mammogram today. October is Breast Cancer Awareness Month, and all three of them have said early detection is the best. Do not let COVID scare you. Schedule. It's very important. Early detection is the best way to
Save lives.
save lives. Fight this cancer head on. Thank you so much. And I hope you have time today to enjoy the nice weather before the rain comes out. Again, I am Heather Fry with the Claremont County Chamber of Commerce. We like to thank Mercy Health for being a sustaining sponsor. And I believe we're going to be talking to you guys more in the future. Not only are we a Chamber of Commerce that focuses on business advocacy, but we also focus on our community, and saving lives is something we'd love to be a part of. So I know that getting this message out there about breast cancer awareness, early detection is important. So from all of us here at the Chamber, we thank you for joining us this morning.
Thank you.
Thank you.
Thank you for having us.
Yes, I hope you guys have a great day, and stay tuned, Chamber members. We will have more interviews coming up. Just, you never know what we're going to do next, right, Allie? You never know. Have a great Friday, everyone.
Thanks.
Bye.
You too.
Thanks. Bye.